Hello, my name is Génesis Flores and my topic is TARGT gene therapy platform for correction of anemia in end-stage renal disease. Definition: Transdose autologous restorative gene therapy. It is a new autologous protein delivery platform designed to provide sustained secretion of proteins such as recombinant human erythropoietin. The procedure consists of collecting several biopsy samples from the patient's dermis, it is autologous dermal explant, and transducing them ex vivo in order to carry a gene, in this case EPO, which encodes the human erythropoietin protein.
Gino and his family are on their way to Boston Children's Hospital. Gino is going to the hospital to undergo ex vivo gene therapy. Genes are part of your DNA. They're the blueprints that tell your cells how to do what they do best. But sometimes, genes make mistakes. Ex vivo gene therapy will allow doctors to replace the genes in Gino's body that are making him feel sick. First, the doctor will draw blood from Gino. And using a special device called an apheresis machine, they will separate the stem cells from the blood and put the rest right back into Gino. A stem cell is special because it has the potential to become any cell that Gino needs. Drawing the stem cells with an apheresis machine may take a few hours, so Gino is going to sit tight in the meantime. Once drawn, Gino's stem cells are taken to a clean lab to receive their new therapeutic genes. These new genes will travel into Gino's stem cells via a vector. Vectors are made from viruses, but all the virus genes have been removed, leaving only a tiny, powerful vehicle that knows exactly how to get into the cells. While this happens in the lab, Gino needs to get ready for his new and improved stem cells. To do this, he'll need to undergo chemotherapy to remove the old stem cells and wipe the slate clean for the new ones. Chemotherapy can be uncomfortable, and Gino may feel a little sick or lose some hair, but this will pass. While Gino prepares, his stem cells are safely stored in liquid nitrogen until they are ready to be put back into his body. Finally, Gino's stem cells are returned to his body. Those new and improved stem cells with new and improved genes can now make copies, becoming all the cells that Gino needs to feel better.
I'd like to make the point that I think a lot of us in nephrology today, we tend to think that the patient is anemic when the hemoglobin level is below a point where we can treat with EPO drugs, but that's not really anemia. Anemia is when the hemoglobin goes below, say, 11 or 12, and there are things that we need to do in terms of evaluation at that point. I don't feel at the time of this taping that I really understand why anemia is worse in patients with diabetes. We can certainly think of reasons why that might be the case, but it is.
The stabilized HIF-alpha subunit translocates into the nucleus to heterodimerize with HIF-beta subunits, activating the hypoxia response genes, which stimulate a host of proteins which impact erythropoiesis, iron availability, angiogenesis, as well as energy utilization. And obviously, as kidney disease progresses, since that's the major source of erythropoietin, there is a relative decrease in the EPO production. It's not eliminated. In fact, the measurable levels of erythropoietin are comparable to what would be expected in a normal individual, albeit not at that degree of anemia. If a normal individual had that degree of anemia, the measurable erythropoietin levels would be significantly elevated because of increased production by the kidney.
Application in medicine. Anemia is a common complication of chronic kidney disease CKD, and is associated with a decrease in the quality of life of patients as well as an increase in morbidity and mortality and CKD progression.
In order for our bodies to stay healthy, we must have a waste disposal system to filter our blood and clean out all the waste products. The good news is we do have such systems in our bodies, and we call them kidneys. But the bad news is, once our kidneys are damaged, it is very difficult for them to repair themselves. Without proper care, kidneys are slowly overwhelmed, and that leads to chronic kidney disease or kidney failure. Across the globe, 10% of the population is affected by chronic kidney disease, and these statistics are getting worse because there is no cure. The only two options for patients are dialysis or an organ transplant. However, researchers believe that gene therapy may become the next treatment option for those with chronic kidney disease. Scientists have found that administering gene therapy may reverse damage in kidney cells, suggesting a potential treatment for chronic kidney disease. In one study, a team evaluated 6 AAV viruses, both natural and synthetic, in mice and in stem cell-derived human kidney organoids. A synthetic virus known as ANC80 proved successful in reaching two types of cells that contribute to chronic kidney disease by secreting proteins that gum up the organ and cause irreversible damage. The results showed that the genetic material carried by ANC80 was transferred successfully to the targeted kidney cells, and the same virus was also used in gene therapy strategies to treat mice with kidney scarring.
The main cause of anemia in CKD is inadequate production of endogenous erythropoietin, a hormone that acts on the differentiation and maturation of the precursors of the red series. The anemia associated with CKD is usually normocytic and normochromic and without an iron deficiency. Parameters include the following values: hemoglobin less than 13 grams per deciliter in men and less than 12 grams per deciliter in women, and ferritin greater than 100 nanograms per milliliter and transferrin saturation index greater than 20%.
Chronic kidney disease, CKD, is a gradual loss of renal function, typically developing over the course of months or years. Many conditions, both within and outside the kidneys, can cause progressive damage to the kidneys over time, leading to CKD. Of these, most common are diabetes and hypertension, both of which directly damage blood vessels within the kidney, destroying renal tissue. An acute kidney injury, if not completely resolved, may also become chronic kidney disease. The severity of renal disease is evaluated based on glomerular filtration rate, GFR, an indicator of how well the blood is filtered by the kidneys. GFR is calculated as a function of serum creatinine, a waste product that accumulates in blood plasma when renal function declines. The calculation takes into account the patient's age, gender, and race. Symptoms develop slowly over time, progressing from renal insufficiency to end-stage renal failure. Often, initial loss of renal tissue does not produce any symptoms because the remaining healthy tissue becomes more active and can temporarily compensate for the loss, a phenomenon known as renal adaptation. Symptoms appear when a significant portion of kidney function is already lost. The ability to concentrate urine is usually the first to be impaired, resulting in frequent trips to the bathroom, especially at night. Other early signs include fatigue, loss of appetite, and decreased mental ability.
In a scientific study, it was found that patients who underwent TARGT teeth implantation had an initial increase in plasma erythropoietin levels, and plasma hemoglobin levels remained above or within the desired range for most patients.
Our kidneys do have a natural ability to repair themselves, but only to a limited degree. Stem cells have the ability to convert into any type of cell in the body. A number of different types of stem cells have been tested in animals and in clinical studies for potential use in treating kidney disease. Among all the cells under investigation, a type of cell named mesenchymal stem cells, or MSCs, have shown the most promising results to date. Studies suggest that MSCs may be able to enhance the ability of the kidney to repair itself. Researchers investigating the therapeutic effects of these bone marrow-derived MSCs in treating kidney disease have suggested these cells may release proteins that can help kidney cells to grow, inhibit cell death, and could encourage the kidney's own stem cells to repair kidney damage. Researchers have also identified some cells in the kidneys that showed a regenerative ability. These cells, which were characterized by the expression of a molecule called CD133, were able to survive injury and create different types of kidney cells. When researchers further investigated these cells, the team found that CD133 is an important factor in helping damaged kidney cells to recover. They also found that CD133 prevents aging of kidney progenitor cells, the kind of cell needed to help grow new cells to repair the kidneys in the future. This finding opens up a number of possible lines of research, including exploring whether infusions of CD133 could help patients whose kidneys are no longer able to produce enough of the molecule to help repair damage. Hopefully, patients won't have to wait too long for these breakthroughs to bear fruits. Perhaps someday soon, we will be able to cure kidney failure with treatments other than dialysis or kidney transplants.
Pros and cons. Pros. Gene transfers can be used to treat a variety of processes that affect the kidney, including the transplanted kidney. Possibility of transporting large genes. Great genetic stability. Chronic kidney disease is a slowly progressive disease, so this is an advantage, and it is possible that in the future, patients may require only a couple of injections a year for their treatment. Cons. In immunocompromised patients, TARGT can cause viral infections. TARGT only allows the integration of actively dividing cells, as there are difficulties in controlling and ensuring expression. The host response to the virus appears to limit the duration of expression and the ability to repeat the dose. The size of the genes that allows the introduction of TARGT is limited, and there is potential for damage to the genome. TARGT can produce a high level of immune rejection, and its genome is very complex and not fully understood, so it can also be influenced by the external conditions. Issue applied in Ecuador. In Ecuador, as reported by Cárdenas Rea, there were until 2012 about 150,000 people diagnosed with chronic kidney disease. This figure is equivalent to 15% of the admissions hospitals. According to a report from the Ministry of Public Health, during its silent evolution with CKD, the patient can experience renal progression, leading to complications such as severe anemia or cardiovascular alterations, which, if not provided timely treatment, morbidity and mortality is high. The standard treatment in chronic kidney disease is the hemodialysis. Thus, also another innovative option is gene therapy, which has proven to be effective in many diseases. However, in our country, it is still limited. Conclusion: erythropoietin administration through the TARGT system has been shown to be effective in patients with end-stage renal disease and anemia. This innovative therapy improves the prognosis and quality of life of the patient, and compared to other studies, TARGT rapidly increased plasma erythropoietin and plasma hemoglobin levels, improving the patient's condition. Thank you.